type of stuff right here, y'all. This is a warning. This is not fear. This is a warning. I did a video over a year ago about this, but now it's real. Here we go.
On 26 January, India notified WHO of 2 confirmed cases of NIpah virus disease in West Bengal state. As of today, no additional cases have been reported. The 2 cases are in a health facility receiving supportive care and didn't travel while symptomatic. No cases have been reported in any other country associated with this outbreak. At present, based on current information, the risk at national, regional, and global levels is considered low. WHO will continue to closely monitor the situation in India and other countries, regularly continuing to assess the risk and provide technical support to local health authorities. We are waiting for India to release the sequence to assess any potential mutation, but there is no specific evidence that would make us worry for the time being and based on the information that we have. All hypotheses are being assessed, including consumption of raw palm sap, as we usually see, and or potential exposure through healthcare facilities. And yes, I said that the virus can transmit human to human. This is true. And this happens in limited instances through prolonged contact with a sick patient without wearing adequate clothing.
All right. So I had to turn the caption on because I couldn't even understand what she was saying. And I wanted y'all to see that. But also, I'm going to break this down right here. This right here is a patient suffering from the virus infection and shifted to an intensive care unit, isolated ward in a college district in the southern state of India. All right. I'm finna let AI read this article because when I started reading this article, this was perfect. Here's a video, 2 minutes. I ain't even watched this video yet, y'all. Let's see what they doing because I'm having chills. I'm trying not to hold it up. I caught COVID before. I was living in Indiana. I happened to catch China news. They had 4 million people on lockdown. They was talking about it. Kind of late with this one, but I just heard about it yesterday. All right, here we go. If it don't work, I'm still going to let this article read. Okay, here we go.
Markets in Kerala bustle like normal, but fruit sellers sit idle. It's a rare sign that a deadly virus is gripping their community.
We are afraid of eating these fruits because this NIpah virus is spreading. So due to that, we are afraid to buy the fruits.
Listen to
An
him.
outbreak of NIpah virus in Kerala this month has killed more than a dozen people.
More than a dozen
its natural
people.
host is the fruit bat, and while it's not confirmed that's how this outbreak started, it's enough to stop people from eating anything the bat may have touched.
After this virus,
they're attacking the fruit,
y'all.
Really
bad. The products are just not getting sold. Early,
you can't make this up. They attacking the fucking fruit. The people said, we don't even want the fruit. He might have touched it. That ain't even no playing factor, y'all. This is real. All right, hold on.
I used to sell 1 kilogram for 50 rupees, but now I have to sell 2 kilograms for 50 rupees. This
I'm
is
gonna turn on the caption.
Everyone is saying that fruit bats this and fruit bats that, so nothing is getting sold.
Kerala's hospitals have been overrun with people sick with fear. NIpah virus causes flu-like symptoms and brain inflammation. It kills 75% of those it infects, and there is no vaccine.
No vaccine.
India's health ministry is trying to quell concerns. They sent teams to
Hold
monitor
up,
for
dog.
new cases.
Hold up, dog. Hold up, dog. So this first one they came up with came from China. Now the second one they done came up with came from India. You can't make this up, y'all. I'm warning you now. Take it serious, man. Do what you need to do. Get right with your family. Get right with your most high God, the only one that lived. You need to get right. You need to get right.
And says the virus has not spread, and yet
Shit.
silence. Tourists are steering clear of Kochi, Kerala's biggest city. It's 200 kilometres from the outbreak, but still vacancies here are up.
We are getting quite
So
a lot
that's
of
ground
cancellations
zero.
from the domestic sector.
So
There are a lot of
check that out. Hold up. We're going to go back to that. Because if that's where it happened at, why it ain't taped off? Why they not investigating? What a bat at? If you blame it on the bat. All right.
Kerala's biggest city. It's 200 kilometres.
I ain't back
Has
far
not
enough.
seems to
Here you
monitor
go.
for new cases and says the virus has not spread, and yet silence. Tourists are steering clear of Kochi, Kerala's biggest city. It's 200 kilometres from the outbreak, but still
200
vacancies
kilometers.
here are up.
we are getting quite a lot of
Okay, so
cancellations
that's
from
not
the
the
domestic
spot.
sector. There are a lot of enquiries from the Gulf countries because the Arab season is coming up, and they are also getting worried.
Arab season.
The World Health Organization has listed NIpah as one of 8 priority diseases, alongside Ebola and Zika, that could cause a global epidemic. It was discovered in Malaysia 20 years ago and has killed more than 200 people since.
You hear that? So they found out 20 years ago about it. 20 years ago about it. This ain't new. This ain't new. I'm telling you, nothing is new under the sun, y'all. You gotta get in your scripture.
Containing NIpah in the world's second most populated country is a challenge. So far, fear is spreading faster than the virus. Charlotte Ballas, Al Jazeera.
All right. So that was that video that I just happened to see. Okay. So back to the article now. All right. So it's going to read the article for us. And I just want you to listen, man, because it, like I said, this is not to put you in fear. It's just to prepare you. That's mainly what I want to do. Oh my God, I don't know why my camera messing up. That's mainly what I want to do. I just want to prepare people, warn people. I know a lot of my other videos been like reaction videos, but this is me. All right, let's go. I did change the voice to more appealing voice.
Why is India's Nipah virus outbreak spooking the world?
Okay.
The virus spreads from animals to humans via person-to-person contact or through consuming contaminated food.
Or contaminated food. So this is why, and I'm sorry, I'm finna break down this article. That's why the people in India are staying away from the fruit, because where they live, those bats eating on fruit. They munching on fruit. They flying around. So they don't know what they fooling with. And like I said earlier, if you didn't hear, this is one of the people. It's gonna read it. I'm sorry.
Why is India's Nipah virus outbreak spooking the world?
All right.
The virus spreads from animals to humans via person-to-person contact or through consuming contaminated food.
Here we go.
A patient suffering from Nipah infection is shifted to an intensive care unit of a Nipah isolation ward in Kozhikode Medical College, Kozhikode District, in the southern state of Kerala, India. File, CK Fancier, Reuters.
Like I was telling you. All right. I was gonna read the article for us. think that's gonna be it. We're just gonna do it to like right here. All right. That's where we're gonna go from right here. So we already heard the other part. Where is it? I ain't do it right. Oh man. Okay, it's right here.
Why is India's Nipah virus outbreak spooking the world? The virus spreads from animals to humans via person-to-person contact or through consuming contaminated food.
Right.
Share. Save. An outbreak of the Nipah virus in India's eastern state of West Bengal has heightened concerns in China and several Southeast Asian countries, prompting them to tighten health screening operations at airports as millions prepare to travel for the Lunar New Year holiday.
So what they're saying is, the whole world doesn't celebrate the New Year at the same time, if you didn't know that. That's why I haven't really gotten into the conversation of our New Year isn't the real New Year. On January 1st or whatever America does, it's not real. It's more like in April, if you really follow the scriptures. But anyway, they're having travel issues right now on the other side of the world because it's their New Year's and they're trying to travel.
Since December 2025, 2 confirmed cases of the virus have been reported in West Bengal, India's health ministry said on Wednesday.
Okay.
Recommended stories.
So this is why you're hearing about it, because of those 2 in West Bengal, India. All right? So pay attention now. This is why I really want this article to be explained in detail. Because when I was reading it, I said, wow.
The ministry did not provide details about the people infected but noted that of a total of 196 contacts linked to the confirmed cases, all traced contacts have been found asymptomatic and have tested negative for the virus.
So they're claiming, but noted, 196 contact linked and confirmed cases. All traces contacts have been found, have been tested and negative for the virus. That's 196 more people got it, y'all. That's 196 more people that got it. That's why they said it. Because if it wasn't an issue, they wouldn't say nothing. I'm telling you.
Situation is under constant monitoring, and all necessary public health measures are in place, the ministry added.
Okay.
A district health officer told Reuters that the 2 people infected in West Bengal in late December were health workers.
Both
are being treated at a local
health workers. So there you go. So you hear that? A district health officer told that the 2 people infected were health workers. So somebody came in that was sick. They didn't know what was wrong with them. They didn't got bit by the bat. They didn't ate the fruit, something. Or we don't even know if it's really from a bat. That last one they blamed it, the West Nile, maybe on the chicken, or I don't know what they blamed it on. Some type of animal. Let's go.
Hospital, the health officer said. Is the recent outbreak of the virus a cause for concern? Here's what we know. Deadly Nipah virus claims lives in India.
Okay.
Minneapolis immigration protests. Demonstrators angered by shootings. What is the Nipah virus?
Okay, here we go.
The Nipah virus (NIV) is a zoonotic virus, a disease transmitted from animals such as fruit bats and flying foxes to humans. It can also be transmitted to humans via contaminated food products or directly from person to person.
Boom. Right there. Right there. That's why the people in India are shit scared. They don't want to eat. They ain't trying to be around nobody. They don't know what's going on. It's coming from animal to human. It's going animal to animal. And the animal affecting the food. And it go person to person. You ain't got no way around it. If you really think about it, if it's animal to animal, animal to human, human to human, and animal to food. So none of the humans scared to eat the food. I'm telling you, boy. These dark powers, they work, y'all. Better wake up.
The virus can be deadly.
Right here.
It typically incubates in the human body for 5 to 14 days, with symptoms occurring within 3 to 4 days. It causes severe respiratory and neurological disease in humans, progressing from fever and headache to acute encephalitis, brain inflammation. In severe cases, Kaya Abbas, Associate Professor of Infectious Disease Epidemiology and Dynamics at the London School of Hygiene and Tropical Medicine and Nagasaki University, said,
"That's crazy.
Symptoms can also include convulsions and mental confusion, and patients can fall into a coma within 24 to 48 hours.
Bruh, do you hear all this stuff that's going on? Comas, what do you say? Neurological issues, headaches, neurological disease. Man, it get crazy. 14 days, man. I don't know, dog. I don't know, man. They really whipped this one up, y'all. I don't know if a mask could be enough.
The case fatality rate is high, between 40% and 75%.
40 to 7. Hey, you know how big of a jump? So 40 to 75% of people gonna die who get it. I think that was higher. We have to look up the COVID percentages, but I think this way higher than the COVID percentages.
Among people infected with the NIpah virus, Abbas told Al Jazeera.
Right here.
However, the virus's basic reproduction number, which is the expected number of secondary infections stemming from a primary case, is typically below 1, he said.
Typically below 1.
This suggests the virus spreads in only a limited way via human-to-human transmission, and there is a low likelihood of the virus becoming a widespread pandemic.
Yeah, right.
Where have outbreaks of the NIpah virus occurred before?
Okay, so it's talking about the article. This was a great picture. Here are the symptoms: fever, headaches, drowsiness, disorientation, mental confusion. Are you serious? Symptoms can progress to coma. See? What, man? Damage. 14, 15 days. Illness apparent 3-4 days. Respiratory illness, early part of infection. Long-term damage. See what I'm saying? Death rate, 40 to 75%. Target in the body. Inflammation of the brain. Your brain, bro, swelling and, man, respiratory, throat, breathing, lungs. It's wild, y'all. All right, here we go. This is where the article finna pick back up at. I hope y'all paying attention. I hope y'all checking in right now, man. For real. This is one of my best videos right here, y'all.
The first known outbreak of NIV was reported in 1998 when pig farmers and butchers in Malaysia.
And like Mr. Motivator said, subscribe, follow, hit the check.
Malaysia and Singapore contracted it from infected pigs. At least 250 people were infected, with more than 100 deaths.
So they blamed it on pigs first.
In 2014, NIV infections in the Philippines were associated with the slaughter of horses and consumption of infected horse meat.
Okay. Then it went to horses.
Since 2001, there have been sporadic but recurring outbreaks in South Asia, particularly in Bangladesh and India.
So as you can see, the first known outbreak was reported in 1998 when pig formed. Once again, that's why it's unclean. The pig is unclean. You shouldn't eat it. Read your description. At least 250 people were infected and 100 deaths. So half of them died. I ain't heard about it. I ain't hear about the horses. Let's go, man. According is where we at. According. Wow, y'all.
According to the World Health Organization, outbreaks in Bangladesh have been linked to humans consuming contaminated raw palm sap, having close contact with other people's secretions and excretions, and caring for infected patients.
Time out, y'all. I'm sorry, but this is what we be talking about in India. Secretions and excretions. Do you know that's urine and feces? And why y'all around that, man? Why y'all around that? You shouldn't be around that. Man, let's go, y'all. Let's go.
Patients. According to the WHO, the first cases in India were recorded in West Bengal in 2007, but an earlier outbreak was retrospectively identified in the state's Siliguri city in 2001. The 2001 Siliguri outbreak occurred in a healthcare setting where 75% of cases were of hospital staff or visitors, the WHO said.
Once again, they can't control it in the hospital.
Since 2018.
So, like, why? That's what I'm saying, man. It's in the spreading in the hospitals. It's moving. They ain't said nothing. They keeping it under wraps. They don't want nobody to panic. Man, we gotta know. Man.
Dozens of deaths have been reported in India's Kerala state, which is now regarded as the world's highest risk region for the virus.
Now it's the highest.
The reasons for other outbreaks in Indian states are unclear. Some medical experts have suggested outbreaks may have been triggered by human consumption of fruit contaminated by bat saliva or urine, while the Indian Council of Medical Research has suggested that while the virus is primarily spread by physical contact, it may also be airborne. According to Abbas, there is no clear evidence about the cause of the latest outbreak in West Bengal, which has occurred after decades without outbreaks.
Decades. Right.
Abbas said the fact that the two confirmed cases are both healthcare workers in the same hospital indicates a potential transmission from an infected but undiagnosed patient to the healthcare workers at the hospital.
Yep, that's what I said in the beginning. And I ain't never been to doctor school, law school. I'm telling you, it don't take, I'm smart, y'all. Somebody came to the hospital that had it, didn't know what they had, and the people was treating them carelessly. So they caught it. Then it just kept spreading in there because they didn't know what was going on with them. Man, you got to treat everything serious, y'all. You got to take your job serious, y'all. Maybe your last time working because you don't take it serious. We're almost done with the article, y'all. We're almost done with you. This is important, y'all.
Is there a vaccine for the virus? According to the WHO, there is currently no approved treatment or vaccine available for people infected by the virus or animals carrying the virus.
Can't save you on
the University of Oxford has been conducting clinical trials in Bangladesh to test a NIpah virus vaccine and launch the second phase of trials in December 2025. In the absence of approved vaccines, doctors have been treating patients with antivirals such as ribavirin. According to the United States Government Centers for Disease Prevention and Control (CDC), ribavirin was used to treat a small number of patients in a 1999 NIpah outbreak in Malaysia, but its efficacy in treatment remains unclear.
Didn't follow up.
The CDC has said that the drug remdesivir could also help prevent NIpah when given to exposed non-human primates.
Non-human primates.
The Indian state of Kerala used remdesivir during a 2023 outbreak which resulted in an improved case fatality rate. Which countries have announced enhanced screening for Nipah virus?
Okay, here we go.
Thailand, Indonesia,
Okay.
Nepal and Malaysia have all tightened international
Tighten up.
airport screening.
Tightening
Thailand's
up.
health ministry told
And
journalists...
see, if you pay attention, the first thing they tighten up on is the planes. Because them people in them planes, coughing, sneezing, touching stuff, ain't no telling where they been at. Ain't no telling what's in their pockets. Ain't no telling what's on their clothes. Yeah, man. You know, that, and I'm trying not to veer off, but once again, if man was meant to fly, you would have wings.
Journalists that it has assigned special parking bays for aircraft arriving from Nipah-affected countries, and passengers have been asked to complete health declaration forms before immigration.
There you go.
Thermal scanners have also been installed at the Suvarnabhumi airport in Bangkok to screen people for fever and other symptoms of the virus.
Scanning people. Here we
Malaysia, Indonesia and Nepal have implemented similar measures at their international airports.
Here we go. It's coming to America.
What is the best way to prevent the spread of this virus?
All right, listen.
On Wednesday, Hong Kong Daily The South China Morning Post reported that social media channels in China had been flooded with posts from people expressing concern over the outbreak of the virus in India.
Yep.
It's so scary, especially with the Spring Festival coming up.
See, they thinking about going out, having fun, these festivals. They finna shut all that down. They finna shut out because there's going to be too many people. Once again, it's coming, y'all. I'm telling you now, it's coming. Man, my camera keep messing up. I'm not paying attention. I don't know why it's messing up, y'all. I'm sorry. All right, let's go, though. We got to get this information.
I don't want to experience another lockdown, one social media user said. Can't we temporarily shut the travel channel with India? Another user asked, according to the SCMP. China's state broadcaster, CCTV, reported that the country has not recorded any Nipah virus cases so far but warned that there could be risks of imported cases.
Yep, they coming.
According to Abbas, however, the virus is not like the COVID-19 virus which resulted in year-long lockdowns around the world from 2020. He said severe cases of the Nipah virus could be managed through intensive supportive care.
Look, they try to keep it going.
He added that besides airport health screenings, countries should focus on promoting measures to prevent the virus, like good hygiene, proper ventilation, avoiding crowds, staying home when ill, seeking timely medical advice and maintaining a healthy lifestyle to support immunity.
It's the same thing.
The WHO has also provided guidelines for controlling the spread of the virus. In particular, it stated in a 2018 report, decreasing bat access to date palm sap and other fresh food products is required.
Look, now they finna get the bats.
Keeping bats away from sap collection sites with protective coverings such as bamboo sap skirts may be helpful.
Bats.
Freshly collected date palm juice should be boiled, and fruits should be thoroughly washed and peeled before consumption.
Should have been doing that.
Fruits with sign of bat bites should be discarded, the WHO reported.
What about the urine? You don't know.
It added that people should wear gloves and other protective clothing while handling sick animals or their tissues and during slaughtering and culling procedures.
Should have been doing that.
To control the spread of the virus in healthcare settings, WHO said, contact and droplet precautions should be used in addition to standard precautions. In some cases, airborne precautions may also be required. Close unprotected physical contact with Nipah virus-infected people should be avoided.
Ben should have done that.
Regular hand washing should be carried out after caring for or visiting sick people, the WHO added. What does the U.S. withdrawal from the WHO mean for global health?
All right, John.
The U.S.
That's it, man. That's it. Like, I don't get no real than this, man. I found the best article warning us. It's talking about it's been happening. Look, the first outbreak, y'all, 1998. The first outbreak. Where'd it go? Oh, I just had it. I was right there. Right there. It's been happening since 1998, y'all. 1998, 2024, 2021. Yeah, man. 75% cases. Started when they went to the hospital. 2028, dozens deaths in India. They've been knowing about it, y'all. Well, girl said, can we shut down India from flying? He said, nah, let's just limit. Man. But yeah, I want to show you, you can go to YouTube, type in True Talk Lounge, TRU, True Talk Lounge. I want to show you. True Talk Lounge. That's my page. That's my page, right? Boom. That's my page, True Talk Lounge. I'm not subscribed to myself. Go to videos. You go all the way down. All the way down like a year ago. I did a video. That was 8 months ago. New COVID. That was something else. But we knew something big was coming. And that's it. Yes, there you go. Disease X. Disease X. I knew something was coming. Just a year ago. It's probably bad. A good intro. It's a year ago.
You need to learn how to garden.
See?
You need to get your immune system stronger.
I'm warning you then,
I'm telling y'all, man. Check out these clips. I got some more clips coming next. I got some more clips coming, y'all. I'm finna start dropping more. I gotta get out there for y'all. But I'm telling you, wake up. Wake up.
Yep. 2 years ago. 2 views, y'all. No views.
Just pay attention, y'all.
2 years ago.
Pathogen. Let's bring in Dr. Amish Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security. Thanks so much for being with us.
What are you talking about?
COVID-19 has killed almost 7 million people worldwide. What would a virus 20 times deadlier be like? And is that a possibility that we could see in our lifetime?
Listen.
It's definitely a possibility, because if you look at COVID-19 and compare it, for example, to the 1918 influenza pandemic, you can see that it is magnitudes less deadly than 1918. And there are strains of viruses that have very high mortality rates that could develop the ability to transmit efficiently from human to human. If we did so poorly with something like COVID-19, you can imagine how poorly we would do with something like a 1918 level event.
Do we know, and maybe this is one of the things they're trying to work out, but where a pathogen like that could originate from as these world leaders think about how to combat
this is perfect, y'all. Listen.
Likely these types of pathogens are going to be respiratory viruses, and they may be viruses that are circulating in certain animal species, but are not able to transmit yet efficiently between humans.
He knew. He said respiratory and transmitted from animals. That's exactly where they saying this one came from, y'all. I did this 2 years ago.
So that could be in bats, like COVID-19. It could be in birds, like bird flu, or it could be some other type of animal species, swine, for example.
And he said bats, y'all.
That interface between humans and animals, where interactions are occurring, that these types of viruses get a foothold. Most of them will die out. But what we worry about is one that can spread efficiently, the way 1918 did.
And so what kinds of preparations might they be talking about? And are there certain roadblocks that we learned about from COVID-19?
I was ahead of the game.
Cleared in terms of, I guess, within individual countries, but then also cooperation across countries. What kinds of topics do you think they're talking about as they discuss disease X?
The whole idea of Disease X is about being proactive, to look at the myriad types of viruses that can infect humans and kind of narrow in on certain viral families that are most likely to harbor a pandemic pathogen and start working in those families, even if we don't know which member of those families, or even if it's an unknown member of those families, might cause the next pandemic or epidemic. So that means thinking about what do you need to do to make a vaccine? What are the antiviral targets? What type of diagnostic tests do you need to have in place? Should we be doing wastewater monitoring? All of those types of questions are being contemplated in the effort to be proactive. And what we learned from COVID-19 is that there are obstacles. We have regulatory and bureaucratic obstacles, and we also have this lack of transparency. For example, in the early days of COVID, it was clear in China that this was spreading efficiently from person to person, yet that wasn't the official line from China for some time.
India,
and the world was caught flat-footed. So I think there are many roadblocks and many problems from COVID. See now is this distrust between infectious disease physicians, public health practitioners, and the general public, because what happened is politicians injected themselves into this, and then it kind of got filtered through all that tribal lens that politics often brings to an issue.
They're talking about Disease X. They just named anything at that point.
For example, with measles outbreaks in Philadelphia, that
he's
are
a senior
fueled by
scholar
anti-vaccine sentiment. So yes,
for
that
the
is
Center
part
of
of
Health
it. That people may not actually be receptive to the protective actions that are being recommended by public health officials, and that's going to come back and make things much more harder than they need to be.
We watched a video from 2 years ago.
We have Life 360 because our kids are growing up.
They're becoming a little bit more independent.
I'll be a teenager and
We have a catchy title, but I think what's is basically how do we prepare for next emergency? How do we prepare our health over next pandemic? We all know very well, there will be viruses, there will be pathogens, there will be outbreaks. The idea is how do we prepare to contain those? How do we prepare outbreaks from becoming full-blown pandemics? We have been working on this for some time. Actually, how do we prepare the health system to respond to not just pandemics, but also other crises? We know there is a looming crisis of climate change that's going to impact our health system. How do we respond to increased number of diseases, whether it's communicable disease, non-communicable disease? We have to prepare. How do we make sure that we have a good global disease surveillance?
I'm freaking this video, y'all. I was bad back then, y'all. All they do all that no more.
They can come up
Look,
with
I'm cutting it up.
Measures, whether it's vaccines, diagnostics, or therapeutics. So
I knew he was
working
lying.
on that. We are looking at vaccine equity. We are looking at ways to make sure that there is manufacturing in various parts of the world. Africa was a big example, making sure that we have capacity there to make vaccines in case there is another pandemic. So those are some of the things we've been working on. But I think today we are really grateful for this distinguished panelist here, Dr. Nancy Brown. Nancy is the CEO, Chief Executive Officer.
Y'all need to go back and watch this video, y'all. Y'all need to go back and watch this video. I'm not going to do all that for you today. I just want to show y'all that, man. It's real. It's real. And if you missed it, this is what I showed in the very beginning. And we're going to end it on this, y'all. Appreciate y'all if you stuck it out to the end. Remember, subscribe, hit the like, follow for more. I did turn the caption on because I could not understand her. Here we go. She warned everybody now. It's just now coming out now to America.
On 26 January, India notified WHO of 2 confirmed cases of NIpah virus disease in West Bengal state. As of today, no additional cases have been reported. The 2 cases are in a health facility receiving supportive care and didn't travel while symptomatic.
See,
no cases.
Once again, at that timeline I showed y'all, it all started at the hospital and then it spread through the hospital and it went out. Because people came in there infected, wherever they came from. It's biological warfare, man.
Have been reported in any other country associated with this outbreak. At present, based on current information, the risk at national, regional, and global levels is considered low. WHO will continue to closely monitor the situation in India and other countries, regularly continuing to assess the risk and provide technical support to local health authorities. We are waiting for India to release the sequence to assess any potential mutation, but there is no specific evidence that would make us worry for the time being, and based on the information that we have. All hypotheses are being assessed, including consumption of raw palm sap, as we usually see, and or potential exposure through healthcare facilities. And yes, I said that the virus can transmit human to human. This is true. And this happens in limited instances through prolonged contact with a sick patient without wearing adequate clothing.
They don't know. They just had to say something.
January,